Hi, I'm Dr. Tiffany Denny. I'm a physical therapist and I'm 9 days post-op. I had an osteotomy and a meniscal root repair. And I thought that I would share a couple videos of some ways that I approach rehab. This is my 7th knee surgery. So not only have I practiced helping people in the clinic, but I've practiced myself with some of this stuff. This video is about heel slides. Heel slides are typically prescribed really soon after surgery to help increase your range of motion. And it took me one surgery to learn that I hate the way that heel slides feel when you do them as I used to teach them, which is, wrap a strap around your foot and then use that strap to help you bend your knee. And as you can see, I barely did it because truthfully, when I do heel slides that way, I think it is extremely painful and my knee gets really stuck. So here's some other ways that I work that same action. And hopefully one or more than one of these will work for you. Now, personally, with my knee surgery, I'm not doing active knee flexion at this point in time, so you're going to see a lot of pulling. And you can, of course, if you are allowed to do active knee flexion, you can add that in to a lot of these. Not this first one though. This first one is specifically intended to be for when you are a little newer and like a little fresher and just need to get a little movement in. Now, if you don't have a foam roller, which is what I'm using right here, you can roll up like a yoga blanket. You can use a couple pillows, like just kind of make yourself something. You could use a ball, something that gets under your leg and starts you off in a little bit of knee flexion. And so this isn't a whole lot of knee flexion. This is about where if you had like a CPM machine, the machine that bends your leg for you, that's about where it would start. So you can start in this position pretty early on. And so here I can use my other hand in some sort of strap, and I can just lift my leg, get my knee as straight as I can, and slowly bend it. Now, my arm's gonna get pretty tired pretty fast doing this. Also, you can see how sitting up, how much my hip is flexed here. So see, I've got my strap kind of long because for most of us, this is going to be more comfortable if we're kind of laying down a little bit like this. And then you can do it up. And I try to squeeze my quad at the top because any chance to do a quad set when your knee is fully extended, take it. Okay, so you could do it with your foot like that, or if you don't like that compression, you can also put your strap kind of under your shin like that and see if that helps. And let it back down. Okay, so that's one way. In truth, I do use that early on just because it's so hard to move around, right? Like the first few days after surgery. That's not my favorite way. This next way, I'm on the ground, so I'm going to use this wall. A lot of the times I'm laying, if you're laying on a couch that has like a long piece that sticks out, you could lay on the couch, or you can lay on the ground next to the couch and use the couch for this instead of the wall, or you can use the wall and the couch back. But what I'm going to do is put my leg up and lay myself down. Now, how close you get to the wall is just going to depend a little bit on your flexibility because you got to get your leg up it, And so here I've got my leg pretty straight. Now, something that becomes really helpful for bending your knee is what I call the hip flexor unlock. Okay, it's not really technical, but if I try to pull my thigh toward my face, and at first I might do that just with my hands, pull my thigh toward my face, use my other foot to make sure my knee doesn't just go sliding, my leg doesn't go sliding too fast, and then I slide my foot down, Now I'm going to use my other leg to slide back up. If you don't have any restrictions as far as actively engaging, you can try and use your affected leg, your surgery side, to slide your leg back up as like an assist. But I'm just passively doing it because I'm just trying to get this range of motion. To me, this one is the best. It's my favorite. It's the most comfortable. And so once I've done a few, once I've gotten past where, okay, I can start to feel that action of my thigh coming toward me, I can start trying to use my hip flexor to draw my thigh toward me. So that's going to be important when I start actively bending my knee again. It's getting that action of initiating with the hip flexor. And I slide. All right. That's my fave. I hope that one helps. And as you can see, this is one way that I get down and move my leg around is by using the other leg. Yeah. So say I'm sitting now. This one I really like to do, every time I get up to go to the bathroom or come back from the bathroom or something like that is a good time to do a few of these. And I'm just sitting now. I can be sitting really close to the edge of my chair. And then again, I can use the thigh lift to bend my knee and my other foot to push it back out straight. And then squeeze my quad at the end there. Thigh lift, bend the knee, other foot, push it back out straight. This one's also, I think, really nice. These are, this sitting one and the one laying down are the two that I make the most use of because I think they are the most comfortable. So they allow me to relax my leg the most and I get the best knee range of motion when I use these two, as opposed to any sort of seated variation where I'm just seated at the same height as my leg. Okay, so there's the sitting up in a chair or on the edge of your couch or whatever. You can also do one where you sit back further. So now my knee maybe starts more bent and then I can use my other foot or a strap to do, this is kind of like using the foam roller, except I have a bigger range of motion. So I've got to sit back further though for this one to get that hinge there. And so you can actually work both of these seated. Okay, and of course if you have something where you can sit really high to where your foot actually dangles, that's another way to do that. Okay, so there's those. Now this next one, I do use some, but probably not as much when I am fresher and when I'm not, when I have restrictions on actively bending and straightening, when I'm still supposed to be more passive. So this next one, you can absolutely use. I have used it, but I do think it goes a little better and is more useful when you're starting to try and be active with that leg again. So again, this is another one where, leaning back or laying down starts to become nice. But here at first, because I'm passive, I do need to be able to reach my leg, or I can try this with a strap too, I guess. Either way, I can sit up. I'm going to be using my other leg to help me out here. So again, I've got to unlock. So I pull up on my thigh and then I use my other leg to pull on the foam roller. Now, if you're actively, if you're working on active motion, this is a good way to kind of assist that. So you can use your surgery leg to pull, but then you let your other leg help you out a little bit. And you probably don't need the strap if you're doing, if you're getting more active. But you can see this is a pretty nice way to do it. And I could lay back for, flexibility's sake. I fully recognize that sitting up like that is a pretty tight position for most of us. So just have to have something where I can help my thigh initiate until I'm actively using my other muscles like my hamstring and my quads. And I'm just not doing that in these types of range of motion yet for my particular surgeries. Okay. Those are my tips. Those are ways that I work range of motion. I actually don't at all work it with the strap around the foot trying to slide it up kind of situation. So, and the other thing that I talked about laying down. The other thing would be like, put your back up against something if you're going to sit upright to do any of this stuff, and that'll help you a lot too. I just don't have a good back where I can also show you right here, but you can also lean back against something rather than having to lay down quite so far. It just depends on your situation, but those are in general the moves. So I hope that helps.